Welcome to this video. Social health insurance law was legislated by the government of Kenya as part of health financing reforms. This is a move from the National Health Insurance Fund to a mandatory prepayment mechanism for healthcare in Kenya in the name of SHA. The government of Kenya legislated the Social Health Insurance Fund, the Social Health Insurance regulations and law that established the Social Health Insurance Authority. The Social Health Insurance Authority is in charge of three main health financing arrangements. Number one, it's in charge of Social Health Insurance Fund. Social Health Insurance Fund is a contributory mechanism by Kenyans. The formal sector as well as the informal sector will be required to pay a premium to access health services. The other key fund under Social Health Insurance law is the Primary Healthcare Fund. Now, the Primary Healthcare Fund, it's different from Social Health Insurance Fund because it is non-contributory. That means the government will allocate some taxes to finance Primary Healthcare Fund. Primary Healthcare Fund will be provided at the facility level from the community, level 1 facilities, level 2 and level 3 facilities. The third health financing arrangement is the Emergency, Chronic and Critical Healthcare Fund. So this fund is also non-contributory. That means the government will set aside percentage of taxes that will be financing this Emergency, Chronic and Critical Fund. Why is this important? This is particularly important because Kenyans will access emergency care and critical care and chronic care regardless of their registration status on SHA, on Social Health Insurance Fund, because it is non-contributory, and this is key to offer financial protection against emergencies and critical care. So those are the three main financing mechanisms under SHA. Now we are having controversies around the transition from NHIF to SHA, and key issues that are coming out with regard to the new scheme include the formal sector is required to pay 2.75% of its salary, of formal salary, towards Social Health Insurance Fund. The key issue it's about whether that amount of financing, that amount of money, will be commensurate to the benefits the formal contributors will be getting from SHA. On the other hand, we will have informal groups who will be required to pay 2.75% of their income to SHA, to Social Health Insurance Fund. The question is, how do we determine the income of the informal sector? So that is a key challenge the government has to work on, to be able to come up with a means testing instrument that is optimal in a bid to be able to get the right definition of who is an indigent, who cannot pay and who can pay amongst the informal sector. So those are the two key issues around the movement, the transition from NHIF to Social Health Insurance Authority. As Kenya continues to improve its health financing systems, so it has to address some of those challenges to be able to realize the goal of universal healthcare coverage. Thank you very much for watching the video, and let's keep talking.